I'm Dr. Jeff Schels with Advanced Chiropractic, and today we're going to go over exactly how to use the Denneroll home traction device. So if you're watching this video, it's because it was recommended that you use this at home to help get more of a curve in the neck area. So we're going to go over how to use it, we're going to go over exactly what it does, and then we're going to demonstrate its usage so that you know exactly what you need to do to get the very best results. So the way the Denneroll works is you lay on it with the shoulders facing this direction, just like this, and you just drop your head back so that your head is dropped back over the Denneroll. And the key is your head really has to be dropped back so that it's not touching the floor. If you use the Denneroll and your head actually touches the floor, you'll need to put a little book or something to raise the Denneroll up so that your head actually just drops back. And the other thing is, when you use the Denneroll, you always want to use it either on a yoga mat or on a carpet. You know, on a bed, it sinks into the bed and you really don't get much traction, or a hardwood floor is a little bit too hard for that. The other thing is, you know, with the Denneroll, there are people that when they lay on their backs, that they have low back pain. So it is okay with this Denneroll to actually bend your knees up to take a little bit of that pressure off the low back when you use it. So the way that it works is this: you lay down with the Denneroll just like this, and you just drop your head over it. And what happens is, if you want to take your neck from where there's a reduced curve to where there's more of a curve in there, there's this ligament that runs along the front of the neck called the anterior longitudinal ligament, and it has to go from this to actually lengthen. It has to get longer. And so the way that it works is, once you lay down, it takes that ligament and it puts tension on the ligament. Now, for the first 10 minutes, the ligament doesn't actually lengthen, okay? It just has tension. After 10 minutes, the ligament starts to lengthen, and it will lengthen for 10 minutes. So the first 10 minutes you lay on it, there's really no structural changes taking place, and it's really the next 10 minutes where you actually get a change in the shape of the spine. So the key is, even though you always start it just at 3 minutes, and then the next day you do 4 minutes, and the next day 5, and you add 1 minute a day when you first start, the key is you really do need to get up to 20 minutes, okay? Now, we recommend at least 5 days a week. Now, a person can do it more than that, but there's no benefit in doing it any longer than 20 minutes at any one time. But 5 days a week is the key, that over a period of time to actually lengthen that ligament and get more of a curve in the neck through there, all right? So now it depends on your specific condition as to when you will start using the Denneroll. You know, there are patients that use it right from day one, but there are others that have to wait about a month or so to use it. So your doctor will let you know when you should start the Denneroll. And then next, we're going to actually demonstrate how to use it. Now, you're going to be doing your traction in the middle part of the neck. So when we look at it, the Denneroll is going to go like this, with, again, this towards the shoulders, and this little lip is going to be right in the very middle part of the neck when you lay down. So if you were to wear a necklace, the necklace would typically fall in the lower part of the neck, and at the very top of your neck is the hairline. So it goes right in the middle. So I'm going to have you lie down, and once you lie down, you're just going to place the Denneroll so that that lip is right in the middle part of the neck, and then your head will just drop back. And of course, you don't want the head to be touching or anything like that. If you do have pain in the low back, you can certainly bend your knees up, but you'll just lie just like this, again, starting at 3 minutes and then adding 1 minute a day until you get to 20 minutes, 5 days a week. Now, if you're doing it, it's very typical that a person might have some discomfort as the neck is literally changing its shape over time. However, if it becomes too uncomfortable or there's sharp pain or anything like that, then stop doing it and make sure that you talk to your doctor about that.